phobias are irrational fears. So you can have irrational fears for virtually anything. So depends they can be multiple in origin. So you have multiple phobias, or you can just have one specific phobia. So, for example, you had a fear of snakes. So long as you weren't a snake charmer and you couldn't do your job, then presumably you could get away with having a fear of snakes in this country, because you just avoid going to the zoo or being in parks or open areas where there might be snakes available. So you'd avoid those. But if it's a restricting illness, there's various types. There's agoraphobia, whereby you're frightened of going out. Agoros is Greek for marketplace, so it's a fear of the marketplace. So it's a fear of open spaces, in other words. And some patients never go out of their house. They stay in the house for years because they can't even go into the garden. Otherwise, they're terrified and they have panic attacks and marked anxiety symptoms, or they can't cope. They never go to the shops, never go to supermarkets, never go to the cinema, can't go on public transport, can't do anything. Their lives are totally restricted by their agoraphobia. Then there's claustrophobia, which is feeling trapped, such as being stuck in a lift or an underground station or on a tube train or in the Dartford crossing or on the or flying in an aircraft where you're trapped into the aircraft. So all these situations, claustrophobia can be a real problem. Or the other one is social phobia, whereby going into social situations, meeting people, chatting to people in general, going to a party, for example, and not knowing anybody there and having to talk to a group of people in this situation where you're the centre of attention is difficult. So these people have problems with public speaking, they have problems with authority figures. At school, they're often frightened of their head teachers or the police or people at work, their boss, for example. They have difficulty in relating to people in general. They can't really function very well, and they're often isolated, lonely individuals who find it very difficult to make friends, often have real problems with the opposite sex. So a lot of the men have never had girlfriends in the past, or never. Equally, the girls have never had boyfriends. They find it difficult with the opposite sex, so they're embarrassed constantly. They feel anxious in those situations. They have panic attacks, and then they use the avoidance response, which means they avoid going into the situation. So they avoid going into crowded places, which of course restricts them even more. So it becomes a vicious circle of increasing anxiety, leading to loss of confidence, leading to lack of self-esteem, leading to inability to do anything. So their lives are sort of totally crippled in the end by this illness.